to let it out that yes, TB can be prevented, and it's very important to get treatment for that. So one of the problems that we have at the health department is people think that if they have latent TB, they don't need to be treated. It's very important to get treated so that doesn't become active or so that doesn't spread to anybody else that may have a low compromised immune system. Other things that we have in our community now, we do have a lot of STIs, which is sexually transmitted infection, STDs. And we are getting more and more HIV. So we've had more HIV in the last couple of years than we've had in the recent years behind us. So that's something that we treat. On Thursdays from 8 to 11:30, we do STI, HIV, hepatitis C testing. If you are positive with any of those, we do treatment. And all of that is free. The testing is actually $20, but if you cannot afford that, then we have a way to help pay for that. But the treatment for that is free. So that's something that we really want people to come in and see us, and we'd love to take care of you.
And here today I have 3 important women in our community, and they're going to be introducing themselves very soon. I'll start with Serenity in the green. What's your name and what do you do?
My name's Serenity Alter. I'm the administrator for the Cass County Health Department.
Oh, thank you. So let's see the next one. What's your name and
Hi, I'm Casey Hopper. I'm the school health liaison here in Cass County, and I work with these schools to just help them out and bridge the gap between the health department and the school system.
wow, that's wonderful. Let's see another lady. What's the name? And
I'm Debbie Grimes, and I am health educator. So I go into the schools primarily. I also do classes around town, and then we do some summer safety programs. And we just reach out to the general community and talk about health issues.
all right, that's good. Let's go back to Serenity, and she can explain to us like a few questions we have for the public, what the public needs to know. So I've heard about the outbreak of a few diseases within our community, which I cannot explain because I'm not a doctor or I don't work in any health department. What's going on?
So we have had an increase of latent TB in our community. Latent TB is it's a tuberculosis infection that is kind of sleeping in your body. So it's kind of lays dormant in your body. So it's not contagious, but it does need to be treated. The reason why it needs to be treated is because if you have other comorbidities, or if you have kidney disease, or if you have HIV, or if you're a drug user, or if you take certain medications, it can wake up that infection, and it can make you become active. If you have active tuberculosis, then that can become very deadly if it's not treated. So the thing that we like to do here at the health department is make sure you get treated for both active and latent TB. There has been some questioning whether or not we have a lot of active in our community, and that is not accurate at all. We have very few active cases in the community, but we have had an increase in the latent TB. So again, latent is not infectious. So that is not something that if you go to Walmart or if you go grocery shopping or something like that, you can get from somebody else normally. We do like to make sure it's treated though. So if you come to the health department, we can treat you for both of these. It's free. What we do is on Mondays from 8 o'clock in the morning, it's actually 7 o'clock in the morning until 11:30. And then from 1 to 4, we have what you call a TB skin day. So if you are somebody that is not from a high-risk country, you can come in and we can do just a TB skin test. Those are very popular. A lot of people have had those done. A lot of people have to have them done yearly. So if you're not somebody that is from a high-risk country, if you're from a high-risk country, we like to go straight to a blood draw because a lot of times they have BCG in their country, and their BCG can make that tuberculosis skin test react as it is a positive skin test when it's really not. So if you've had a positive skin test, or if you've had a positive quantiferon, then we will continue treatment for you. So what we would like to do is to do a chest X-ray, and then we do sputum test, and then we go by whether or not you're symptomatic or not. And if you are symptomatic, then you are put on a different regimen, but that regimen is it's medication, and then we will do direct observation therapy, DOT. So we will visit you every single day through your whole course of being active until you're no longer communicable. When you have no longer symptoms and when you're doing much better, then we'll kind of start to get you back into the society and you won't have to be isolated. But that's kind of what we do. To let it out that yes, TB can be prevented, and it's very important to get treatment for that. So one of the problems that we have at the health department is people think that if they have latent TB, they don't need to be treated. It's very important to get treated so that doesn't become active or so that doesn't spread to anybody else that may have a low compromised immune system. Other things that we have in our community now, we do have a lot of STIs, which is sexually transmitted infection, STDs. And we are getting more and more HIV. So we've had more HIV in the last couple of years than we've had in the recent years behind us. So that's something that we treat. On Thursdays from 8 to 11:30, we do STI, HIV, hepatitis C testing. If you are positive with any of those, we do treatment. And all of that is free. The testing is actually $20, but if you cannot afford that, then we have a way to help pay for that. But the treatment for that is free. So that's something that we really want people to come in and see us, and we'd love to take care of you.
So the test for HIV is $20.
Correct.
But if somebody cannot afford it, you have some ways to help them pay
Correct.
for that?
Yes, that's correct.
Okay. So since you've said we have had like a raise in the number of HIV for the last 2 years, are the people coming for treatment here, or they're just not showing up? Like,
yes, we are actually starting to get more and more people that are coming for treatment. This is a new program that we've had with our new Health First Indiana funding that we've been able to get. So yes, we're starting to see more and more people that will come here for this treatment, and because it is free, we do work with the Indiana Department of Health to make sure we have more testing and make sure that it's available for us and that it's free treatment that helps people come in and see us.
well, I know about in our community we have an increased population, and we have our brothers and sisters, the Haitian people. Like, how do you manage the communication? Is it not being a difficult situation, like to communicate with them so you can help them? Because I know most of them don't speak English. Do you have anything to help them with that?
We do currently right now. We have a Spanish interpreter, so a Hispanic interpreter. She's amazing, and she's here on Tuesday, Wednesdays, and Thursdays. We do have at some point in time we have some Haitian interpreters. That will kind of go away here in the next couple of weeks, I think, until we can get something more steady. But we have what you call on our phones, we have the voice system. So, and it is a FaceTime. You can do multiple different ways, but you can do FaceTime, and it's like our translation system is actually talking FaceTime to them. So that's been a real big help for us. Yes, translation is difficult at times, but we work through it, and we welcome everybody to be here, and we'll make it work.
Wow, that's very good to hear. So, can you tell me a little bit about? You've told us how TB is spread. Sometime we have knowledge about that, but about HIV, which ways do people get infected with HIV? Like,
So there's a couple different ways you can get infected with HIV. So obviously sexual, and then obviously with drug testing. If you use syringes, dirty syringes, that's a way. So those are the main ways that what we see around here. Usually, those are the two main ways of what we see. We do HIV, hepatitis C. We actually do pregnancy testing here as well. So we do free, and that's free. We will do free pregnancy tests. But we test for gonorrhea, chlamydia, syphilis, and those are the ones that can be $20 unless somebody is not able to pay, and then we'll obviously help with that.
oh, that's a good service, especially with these kinds of diseases, to be free and easy to get help. That's a very good job you guys are doing, and we do appreciate that. So, how do people like? Do they have to just come at this department to get that kind of help, or some hospital in Logansport, any other?
The hospital does do it. We appreciate when they come to the health department. That way it frees up the ER for other things that are more emergent conditions. So with our free testing or our $20 testing, it is going to be more reasonable for them. And we make sure that money isn't a factor. So if they cannot afford it, we'll make sure that they receive treatment and receive the testing no matter what. But again, it is important that they get tested. So wherever they get tested is great, but we would appreciate them to come here because again, that will free up the emergency room department for more emergent situations. I think it's important that people understand that you can go to Express Med for if you have a cough or a cold or starting to get the flu and stuff like that. But the emergency room is more for emergent, more acute things. So if you're having chest pain or serious illnesses, then that's what the emergency room is for. So if you're going to the emergency room for something like an STI testing or a pregnancy test, we appreciate if you would come here.
Wow, that's good. I have a question that I always want to ask. Like, is that like a test, like a vaccine for TB or something like that? I'm not sure.
No, we don't have a vaccine for TB. We do not have that. We just will treat it if it's something that they need treated for.
You know how long it takes to treat TB?
It depends. There's a couple different regimens. There's one that's it's several months, and you have to take all the medication. If you have latent TB and you don't complete your medication regimen, then you will have to be started on it again. If you have latent TB and you complete your medication regimen, you should be good to go unless it won't turn active unless you are reinfected by somebody. If you're around somebody else that has active TB, and then you could be at risk to get it. But as long as you are not around anybody with active TB, you shouldn't have the problem of becoming of TB again.
Well, thank you. That's very, very great information. And I do appreciate you to say that to the community and the public to learn. So I hope people who are watching from out there are gonna do whatever necessary to make sure they get this kind of help. All right, next here I have Debbie and Casey, and gonna tell us like how they operate in the area of service and what services they have for the community of Logansport. Let me start with Casey. You can all speak, but you can explain to the public.
Okay. As a school health liaison, I work with the schools and the community just to kind of bridge any gaps, to help the school out with whatever they need, to coordinate health initiatives. We actually have, it's called a DAP trailer, which is Drug Awareness and Prevention Trailer, and that has hidden in plain sight things that might be in a teenager's room, such as drug paraphernalia. So you might find something stashed in a little can that looks like a Pringles can, but it's really something that's much more sinister. So that's a really neat program that we are just getting up off the ground. This spring we hope to be in many schools and other places with that. We do offer car seats. So anybody who might need a car seat, whether it's your first time or you're transitioning to a larger car seat, just give us a call. We'd love to help you out. And then we work with a coalition, Stand Up Coalition, Stand Up Cass County. We work with them with vaping policies, issues amongst the youth. And work closely with Debbie so we can to Debbie a little bit about what we do together.
Okay, so I'm Debbie Grimes, and as health educator, Casey and I both work together. We go out into the community and do exactly what it implies. We do any type of health education that's requested of us. We have several programs that are ready, but any health subject that someone would be interested in learning more about, we could certainly research it and present. We go into the schools a lot, and we do, like, they're grade specific, some of the topics. So for high school, we would do tobacco education, and for junior high, we actually like to start early in fourth grade to do prevention. For them, we do, one of the topics that's frequently requested would be bullying. We do hand washing for the younger kids because that's important. I go into the community and I've done factories where I've done Stop the Bleed at their request. We also have classes here if needed. I do some of the local churches, some of the women's groups. I taught on suicide, cyber safety. And we've had some deaths due to people who reacted to dating apps. And so one of the churches wanted to know about that. We teach some classes here at the health department. We do safe sleep, which are for parents with infants, unborn infants, or infants up to 1 year old. And we teach them the safety of how a child should sleep. And by teaching that safe sleep, we've reduced SUDs in the United States by 50%. So it's quite needed. We also do a safe sitter class. So that would be for girls between the ages of about 6th grade through 8th grade. And they can learn life-saving skills for children and how to handle emergencies and everyday babysitting problems. So, that's about it. We have, other classes. We have smoking cessation when I have enough to be able to do that. And yeah, any subject that the community would need, and they would just contact the health department and ask for health education. That would be directed. Summer safety classes. We also do health fairs. There are several area health fairs where we provide educational material throughout the year, actually.
So are all these services you're saying you offer, are they all free?
Yes, absolutely.
Plus, you said you carry out some classes here at the health department. Is it, you have specific days and times that you take classes from here, like to educate people?
Yes.
We usually put out flyers. Sometimes we advertise for our classes on the radio and then on our website. We also do. Or if they're interested in something they've heard about here today, they can call and ask for the next class.
Oh, you don't have like a specific day, like saying that it's Thursday or something like that?
No.
Oh, that's good. All right. So what could be? Let me start with Debbie. What your closing remarks that you would love to give to the community to know?
I just think that there are a lot of health issues that people think about and talk about. People who are diabetics, that have chronic illnesses. I sometimes do the Area 5 senior citizens and some of the other senior citizen groups. And I think that everybody struggles with a lack of knowledge about some of the issues that affect them. And any health related issue that they're interested in learning about, they can certainly contact the health department and ask if we can prepare something for them. We can even meet on a one-on-one with someone or go to their home. We're very versatile.
Wow, that's good. I hope the people that are watching this can learn from that and try to get help as much as they can. How about Casey? What closing remarks you have for the community of Logansport?
I just hope for anyone who is of school age or their parents or family that if they have any concerns, they can always come to the health department and ask for me or anyone else, and we would love to help you through your journey in the school system and just make it the best years of your life.
All right, I'm gonna finalize with Serenity. What's your closing remarks and the advice you have for the community of Logansport?
Well, one thing I'd like to share is this is our mobile clinic that we will be getting for the health department. This is kind of our health department on wheels. We do immunizations. We'll be able to do tuberculosis testing, STI testing, HIV, Hep C testing. Anything that we do in our department, we'll be able to take this on this bus, and we plan to have this in the community very soon. If you see this bus around, feel free to stop up, ask us questions. And know that the health department is full of resources. If we can't find the answer for you, we will find it. We network very well with a lot of other businesses in town, and we would just, whatever it takes to make sure you have your questions answered. So feel free to come out and see us. Feel free if you have questions or you need tested or you need immunizations or vital records or any questions like that, we'd love for you to come out and see us.
Wow, that's very good, and thank you so much for giving me the time to interview about what's taking place in Logansport. And I appreciate it so much. And I hope the people in the community are going to be able to learn from this. My last question to Debbie and Casey. is you talked about the car seats. Do you guys like? Is it like? How did you mean car seats?
They are free for anyone who needs one. If you are having a baby and you don't have access to a car seat or means, by all means, come and see us and we can help you get that installed and learn car seat safety.
Or do you offer them free of charge to people who are gonna give babies?
We do.
Oh, that's good. I hope all the pregnant mothers out there can watch this and know where to get help.
Absolutely.
Do you have any other offers you give to pregnant women, like other services you help? Or at the moment it's just
At the
the
moment,
seats?
it's just car seats.
Okay. All right. Thank you so much. I appreciate you guys. I hope if you see this video out there, you can share it for people to get more message to learn about the health in a community. Or if you see it on YouTube, you can share it with a friend. I'll appreciate so much too if you subscribe on my YouTube channel, The Say Richmond, so that you can learn more from more important people within our community. All right, guys, bye.
Bye.
Thank
Thank
you.
you.